Hello, world. This is Andrew Suggs, CEO and co-founder of Live Chair Health. Hope all is well tonight. We are here to bring you another webinar that we're excited to dispel a lot of myths that are presented and are heard in not only barbershops and hair salons, but throughout our community. I have esteemed panelists with me who will give a brief introduction, but just a tidbit or just a quick blurb about who Live Chair Health is. Live Chair Health aim is to reduce health disparities found amongst people of color, starting with African American men and women first, because our population is overrepresented in every chronic disease category from diabetes, hypertension, and lung cancer, to name a few. So we believe that prevention is better than a cure. And in order to teach that message, we partner with barbershops and hair salons to improve the health and well being of our community. With that said, I would like to introduce our panelists to kick off this wonderful discussion that we have for you tonight. Let's start with, the ladies have to go first. So Dr. Michelle, I would love for you to just give a brief introduction, who you are, what you do, and how did you get connected to Live Chair Health?
Yeah, thank you so much for the warm welcome and hello to everybody who's listening. So my name is Dr. Michelle Ogunwole. A lot of my patients call me Dr. O. I'm an internal medicine physician and I'm also a health disparities researcher at Johns Hopkins. I focus on health disparities, particularly among Black women. And so I'm interested in women's health and pregnancy health as well. And I am super excited about the work that Life Chair Health is doing. I think a lot of my work on how we actually get our communities to have great outcomes and have equal outcomes as other communities is focused on new and innovative approaches, and also this idea that we have to meet people where they are. And growing up, I was in the beauty shop every 2 weeks. I loved it there. I just remember having such good experiences going there with my mom. It's a big part of what I think about when I think about my youth and just the opportunity to be around other women and other people in that space. And so I always love the idea of bringing healthcare and the things that are important to us to spaces where we feel safe and where we feel valued. And so that's what drew me to this organization and just trying to think about ways that I can bring my expertise and my knowledge and work with wonderful people who do the work to make us look good on the outside while I'm working to help us look and feel good on the inside. So I think it's really exciting to be a part of this work. And I'll just stop there.
Absolutely. I really appreciate the introduction. We'll kick it over to Baltimore. Dr. Athol Morgan is on the call. So, Dr. Athol.
I'm Dr. Athol Morgan. I am a cardiologist practicing in West Baltimore, where I've been for more than 20 years. And I first learned about LifeCheer when I was contacted by one of the principals, Franco Tenesa. And I was around back in the 80s when some of the earliest studies were being done on practicing using the barbershop and the hair salon and the churches as places we could communicate healthcare to the general public. And so I always thought it was an exciting idea. Back then, people were really operating on research grants, and when I heard about LifeCheer and the idea that Andrew Suggs had to make this into a viable, sustainable effort, I was excited to join, and I've not been disappointed since then. LifeCheer is making tremendous strides, and we're really affording the opportunity to use these spaces, as Dr. O said, of the barbershop and the hair salon, these conversations among trusted people as a way of communicating healthcare knowledge to the public. So I'm excited to be a part of it. I've enjoyed the ride so far, and I'm excited to be here tonight with the crew and to have the opportunity to talk with, what is it, Andrew, the questions from the streets.
Yeah, dispelling myths and misinformation from the streets. So that was the we used a different word. We had an original word, but streets seemed appropriate. So yeah. So thanks for that, Dr. Morgan. So last but certainly not least, Mr. Shanle Shakoor, owner and operator of Now Style Barbershop. So please give us an introduction of who you are, what you do, and then how did you get connected with Live Share Health?
Sure. My name is Shanle Shakoor. I'm a husband and father of two. My daughter's at Howard University. My son is at the University of Miami. I've been in the barbering industry for years. I own Now Style Barbershop. I'm also a master barber. 22 years in Baltimore, serving the community. I got hooked up with Live Chair about a year ago, and we started doing blood pressure screenings in the barbershop. And one of the things that attracted me to Live Chair was that it was looking to help Black men and meet them where they are. So I felt like I always did things in the community, always had that community service arm. So in order to help my brothers, it was a no-brainer. But one of the things that stood out was when we began to do blood pressure screenings, within 2 months of us doing screenings, we looked at the data and 70% of the clients that were coming in had hypertension. We already knew it was a problem, but now we can do something about it and face it head on. The whole thing with the blood pressure screenings and what Live Chair is doing, what makes it really important to me in my heart, my mentor, Mr. Harry, he was doing blood pressure screenings back in the 70s. And someone who was an advisor for Live Chair, Dr. Kong, actually initiated the program back in 72 with Mr. Willie Harry. So when this was introduced to me and then meeting Mr. Kong, I felt like it was fate, that this is something that I needed to do, that was placed in front of me, and that I always wanted to walk in the footsteps of my mentor and make him proud. So being with Live Chair and doing the things that we're doing, I know he's smiling down upon me. That's me.
Tough to follow that, but thank you for sharing that for sure. Well, thank you, panelists, for the introduction. So let's dive into it. I mean, COVID is a very hot topic, as we know. There is a myriad of different opinions and perspectives on the topic. And so one of the things we want to do at Live Chair Health is make sure that our community is informed with the right information. So having a combination of a hair professional who's in the community and also physicians that are seeing patients, it seems like a natural bridge to have this conversation. So the first question, so I'm going to throw out, because of the title, I'm going to throw out some things that I've heard in the barbershop, and I want to just get an initial response. Oh man, don't get the COVID vaccine because a microchip is going to be planted in you. Who wants to address that first?
Sure, I can jump in. I would say that that's not true. But I understand that in the beginning, before we had any data and any information, how would you know when I say that that's not true, like that you should believe that? And so I think that it's a fair thing for people to be concerned based on some of the history in this country that this vaccine might be used to monitor them in some way, but there's no evidence that that's actually ever happened. And this might be another question that you asked too, but I think what's important for people to know too is now, I think nearly 20 million doses were given out to the public, and there's data on how people did with those doses. So I think that that's what's important. And I'm saying there's more doses than that have actually been given out, but recently there was a big study looking at, 10 million doses of the Pfizer vaccine have been given out, 7 million doses of the Moderna vaccine have been given out. What actually happened to people when they got these vaccines? And so I think that's important. So no microchips were detected in any of those studies. So I'm just going to put that out there. So that's good. And the other really important thing is that there were really, really low rates of people having bad reactions. And there were no deaths reported, so that's important. But there are people who can actually be allergic to things. Like some people are allergic to peanuts, for example, and they can have really severe reactions that we call anaphylaxis. But in both of the vaccines, that rate was really, really low. I think in the Moderna vaccine, there was only about two cases per million people who actually had that really severe reaction. And again, they were able to go to the hospital quickly, and that's why they monitor you after you get these vaccines to make sure that goes away. So that's really encouraging. And so I would say that people who are skeptical, especially about this vaccine, to just continue to ask questions, and then to ask what is actually happening, right? So before it was all just me saying, as a physician, we don't do that. But now you have some of your friends might have gotten the vaccine, and now we have data on all these people. And so I think it's important to think about those numbers too. So when I looked at those, 17 million, I think total that they looked at, I was really excited to see that there weren't any major events and no deaths. So that's where I'll leave it.
Dr. Morgan, I would love for you to chime in, or Shanile. I mean, have you heard?
Andrew,
yeah.
I was a little slow to respond because you left the gate with that one, and I just thought that is so preposterous. That is so preposterous.
I know.
Shanile, there's the one guy who always comes into the shop and has something so off the wall that everybody in the shop goes, "What? Really?" And that's kind of where I was coming from with that. But I want to be more respectful and take it seriously if it can be taken seriously. I think that we have lost some of our faith in our government and in the institutions that we have to protect us. So that leaves a room open for people to think that the government would ever really want to inject us with chips so that they could keep track of us for whatever reason I wouldn't know. I just think that's simply not true. I do want to add on to something Dr. O said, which is that the experience as we have today with the vaccine is it is incredibly, incredibly safe. If you think about it, there have been like maybe a dozen people who have had these allergic reactions. I bet if you were selling shrimp, if you're selling seafood, you're going to get more people in your restaurant allergic to the seafood than have been to the vaccines. I just think it's remarkable how safe they have been. And so, and the idea that the government's actually trying to inject us, I just have a hard time really not thinking of that as a wild conspiracy theory.
Yeah, no, I appreciate the response. And so, I know it sounds preposterous, but these are things that are actually being disseminated and spread throughout the community. So I think it behooves us to address these. And that's a segue to my next, myth or misinformation is, and this might not be as preposterous, but, if you take the vaccine, there will be a microchip implanted into you, right? That might be something that maybe more of us have heard. So maybe let's turn it over to Shanile first to get a sense, you're seeing clients, right?
Mhm.
Have you heard that before, or have you seen that on social media, maybe on a meme? So what do you think about that?
I mean, yeah. I mean, I think we've all seen it. And when you look at COVID, and we're talking about myths, when the COVID first became, widespread news in the barbershop and on memes on social media, one of the biggest things was Black people can't get it. We're immune from it. And you saw the memes with people dancing. There was like a celebration. It was almost, like whites against Blacks, where Blacks began to celebrate like it was a holiday. But then we knew that that was a myth because we began to, contract it, in record numbers. But when you look at that, it's nothing new. It's nothing new by saying that Black people were immune. When you look at, back in 1792 with the yellow fever, It said that Black people were, people of color were immune. When you look, 1870, we looked at smallpox, they said the same thing. So now you come to 2020 with COVID, and they say the same thing. So when we buy these myths, we put ourselves so far behind, and then we have to catch up because we're not social distancing, we're not wearing masks because we're believing the myth that we're immune from it. And this is what hurts us when we begin to believing those things. When we begin to believe that, there will be a microchip, put in us, so we stay away from it. So the education part, that's why these forums are so important, to get those out of the way so we can begin to deal with what's real. We can begin to deal with the truth, and we can begin to heal and take precautions. So
I appreciate that, Dr. O, Dr. Morgan. Please chime in. I'll add one comment. I'll just put this out there. If you have a mobile device, you can be tracked. I'm a moderator, but I'm just gonna put that out there. Dr. O, Dr. Morgan, thoughts?
Right. They don't need any chips. They already have us, right? Well, as Shanile said, as it turns out, the reality is that it appears that the African American population are contracting it and suffering from it even more. So if anybody really needs this vaccine, it's our community even more so, because we're the ones who are disproportionately really being affected in a bad way by the virus. So if we have an opportunity to fight the virus with something like a vaccine, then I think we need it more than anybody else.
Absolutely.
Dr. O, you want to put anything on that, or are you good? Because I have more.
I'm good. I look. I think that you said it. This issue of the cell phone is interesting. I think in every situation we're always going to ask, like, we're going to weigh the risks, and I think I'm trying to get away from this idea of scaring people like you could get COVID. It's really serious. That is very true, but I also think there's this other side about getting back to your life that we are trying to think about too. And so, whatever you need to do to, whatever is going to motivate you to think about this vaccine, to keep asking questions, I think that's what you should think about. But it's funny because when you said this thing about the cell phone, I was like, that's so true. And I think if you weigh the alternative, which is either getting COVID or not going back to your regular life where you could see your friends and family and be in community, both of those things are not things that we want. And so, I think that's how I'm thinking about all this stuff too. So
okay. One other prominent one before I kind of switch gears is, a lot of people in our community say that, they've seen this episode before, i.e. Tuskegee, right? So I think it would be helpful for either Dr. O or Dr. Morgan to, one, educate people on what Tuskegee was and what it was not, and how that is different than what we are experiencing now with COVID.
Well, Tuskegee started out as a research study. And so that's entirely different from what's happening now. What we have on our hands now is a global pandemic of a virus that is devastating the community. The Tuskegee study started out as an experiment, and as you know, Andrew, when it went off the rails is because the research was being done to treat Black men with syphilis, and it became clear halfway through that penicillin is actually an effective way to treat syphilis, and a decision was made not to disrupt the study, and so to continue not treating some people, and that was unfortunate, and certainly not something that could happen today. And it's one of the things that's left a bad taste in the African American community about research. But the problem we have now is not research. It's an actual disease that's out here that we're trying to fight against. And one of the best tools that we have to fight against an infectious disease is a vaccine. And, you know, we can look back at the successes that we've had with vaccines against other viral diseases, against smallpox. Shanile mentioned, you don't see smallpox anymore. Why? Because we have a vaccine. We don't even, we've done so well with smallpox that we're not even vaccinating anymore. It's gone pretty much. Measles, all the vaccines that we got in childhood are tools that that we have in healthcare to fight against infectious disease. And that's what we have now. We have an infectious disease, a pandemic that's out there, and we luckily or skillfully have developed a vaccine against it. And we just need to get the vaccine out there to as many people as possible, as quickly as possible, so that we can begin to manage this epidemic. And as Dr. O says, get our lives back to normal, right?
Mm-hmm. Yeah, and I always try to use this opportunity just to say the name of the study so that people remember that it's the Tuskegee study of untreated syphilis in the Negro male. That's the name of the study, and so that we don't that we're not mixing that up with Tuskegee, the institution, which is a historically Black university that is known for its excellence, and that it has done a lot for the Black community, and it has produced a lot of Black doctors. And so I would just like to say that so people understand, so that we're not using the term synonymously. Sometimes we do. But as Dr. Morgan said, you know, that study was really different. There was a lot of ethical problems with it, obviously, which is that people who had a disease were not given treatment when they could have been treated. You know, that's a really big problem. In contrast, what we're seeing now in this global pandemic is a readily available treatment, well, or a preventative tactic. That's what a vaccine is. A vaccine doesn't treat the disease, but something that could potentially prevent people from getting it. Something that we've all been hoping for, right? Now it's available in our communities, and now the choice is really up to us about whether we want it or not, right? And so it's actually not, it's our decision to make, but I'll just echo what Dr. Morgan said, and something that I hear a lot from other people who are doing this work is that if a lot of people don't get from maybe to yes, our communities are going to be left behind. And what we're all worried about is where that'll really ultimately leave us as a community, as a Black community, right? If other people are getting vaccines and our community isn't. And so I've been really harping on that. You don't have to say yes today, but I think every conversation that you listen to, you continue to ask the question, so you figure out if you're really saying no, how can we answer your questions to get you to move towards a place where you're comfortable, so that you're not part of the people who are left behind. And I think that's ultimately what we're out here trying to work on.
Absolutely. I really appreciate that. One, that historical perspective from both of you. Very helpful. Shanile, let's kick it over to you. You know, there are historically been things that have, you know, marginalized communities of color, and specifically African-American men and women. And so why do you think there is so much hesitancy from clients? Well, do you think that is part of the reason why there's so much hesitancy, or maybe are you hearing other things from your clients?
No, I think that one of the biggest stories is the Tuskegee experiment that, you know, Dr. Michelle and Dr. Morgan talked about. And I'm glad you asked the question, and you asked them to explain it. You know, explain the basis of it and the historical presence of it. Because people come into the barbershop and they don't know. The first thing they say is, oh, the Tuskegee experiment. And they're not educated and versed on actually what happened. Like Dr. Morgan said, this is a global pandemic. That was an experiment. And now, when you look at the medical field, I'm quite sure with things that have happened, you know, with, you know, Henrietta Lacks at Johns Hopkins, you know, using her cells, you know, the Tuskegee experiment, all those things. And I can understand why Black people would say, hey, you know, their mistrust with the medical system. But at the same time, when you look at that and when you do that, again, we put ourselves so far behind without really knowing the true education of it all. So people coming into the barbershop, they're hesitant, cool. But I think one of the things that we need to look forward to in terms of solution is diversity. Diversity in the medical field, diversity in healthcare, period. And when I say diversity, I'm not just talking about Black faces in medical schools. I'm talking about Black faces in clinical trials. When you look at COVID, and when you look at the clinical trials, how many people of color were in those trials? I mean, yes, we can sit back and complain and say, hey, we're not represented, but are we stepping up? And again, I understand because of the history, we don't want to step up. So it's like we're kind of in this bag, but we have to get out of the bag so we can begin to be represented in these trials. So it's not just saying that this will be treated, and it's more focused toward people of non-color. So I would say, diversity in the schools. And when you look at even medical school now, there's a huge decline of Black faces in the classroom. And this goes back to the streets, goes back to the myths, it goes back to the mistrust. So now you have individuals who are kids, like, I don't even want to be a part of it. That's not for us. That's for the other people. But look how much we lose because we're not being diagnosed, right? It just puts us so far behind. So I would say diversity. Diversity is key in every aspect of healthcare moving forward. And I think COVID just shined a light on something that has been, sort of kind of under the cover. But we're having conversations about it, and that's what we're doing right here.
Absolutely. You raised a few good points, and I wanted to turn it back over to the physicians on the call. Specifically for younger folks, there's a common statement that's made as, well, I'm young, I don't have to worry about it. Now, I know, just as a personal aside, I know the data does kind of show that if you're under this age with, not morbidities, like your chances of dying from COVID are very low. But how would you address someone who says that, well, because I'm younger, I'm not old, I don't need to worry about COVID?
Yeah, I'll start. I'll say a couple things because I talk to my family members about this a lot. I think the first thing is, you're right. Younger people, depending on your other medical history, right, may be at lower risk. But we see plenty of young people in the hospital who have COVID-19 and who have died of COVID-19. And so one of the things I just honestly say is, you don't know who you're going to be. So if you have an opportunity to not risk it, then just don't risk it. So that's one thing. And of course, the other piece of this is that even if, while you might not have a bad outcome if you even contract COVID-19, it's very possible that you could spread it to other people who may not be as lucky. Especially, you're right, your older family members or friends or the people that you're around. So I think the other piece of it is that you are in a position to do your part to keep the people around you safe. And what a great opportunity that is. And I even say this to people, I'm vaccinated and I still don't go to gatherings and I still don't do, kind of big events because we still don't have enough data on the vaccine about, even if I'm personally protected, I could spread COVID-19 to other people. So why would I put other people at risk? The same reason, even though I have a low risk myself, I still have made a decision not to do those activities because we just don't know yet. And so I think those are the big things, is that you just don't know. And I guess the last thing I'll say, as like a primary care general medicine doctor who takes care of people with a lot of chronic disease, what we've seen over time is a lot more people, and Shanile spoke to this, right? That a lot of people have chronic diseases that put them at risk for COVID-19 and having a severe infection or a bad outcome. And sometimes we don't know, right? So I think there's a lot of people walking around who have high blood pressure. A lot of people are walking around in our communities who may be, their weight might be over what's recommended for a healthy weight. And not everybody sees that as a medical problem, and yet we know that that impacts COVID-19 outcomes, right? And so and we know that these diseases are happening earlier and earlier. Even my pediatric colleagues are seeing this chronic diseases and high blood pressure in really young populations. And so I think those are all the things that I would tell them, which is a lot, but that's where I'll stop.
I think I would say a couple of things. The first is that we have to be more of a cooperative and collaborative society. And so we have a duty to each other, really. And this is an infectious disease. It spreads from person to person. And each of us has a duty to try not to be part of the chain, to try not to be the one who gave it to somebody. And as Dr. O says, you may be young, and so yeah, you get COVID, you might be ill, you're probably not going to die. But then what may happen to a person who you gave it to? They might die. And so I think each of us has a duty to try not to be part of the spreading of the disease. That's really the problem here. So, don't contract it, don't give it to anybody else. The other thing I thought of is, way back in the 50s when the measles vaccine first came out, measles is generally thought of as a mild illness. You get a fever and a rash and the kid gets better. But us, the physicians, we know that there are a small number of people who are devastated, have terrible neurologic stroke-like complications from measles, and their life is ruined, by this. And there was one such child who became sort of the poster child for the vaccine, was just really willing to be out there to show people what had happened to this particular child. And so it may not be you or the next person beside you, but somewhere, somebody's going to get seriously hurt by this, right? We have lost 500,000 people who are dead. They're not coming back, they're dead because of COVID-19. And you have a duty not to be part of spreading it. I think that's something that we all have to consider.
Can I say one other thing? Oh, I was going to say one other thing. And there's this other point about maybe people have heard this term of long COVID, but there's people who get the disease and maybe it is mild for them. Maybe they don't have a severe course and they obviously live, but they go on to have long-term symptoms. And even now in a research institution, we're trying to figure out, do we need to set up clinics for people who have had COVID-19 and continue to experience symptoms? And so I think the other piece, if you're not really moved by this idea that it could happen to you and you could spread it to other people, is that even if you get this vaccine and do well, you could have long-term complications that could affect the quality of your life. I mean, one of the symptoms of COVID is about affecting your smell and taste, right? And so there's people who are still experiencing problems with that. And, that could seriously affect your quality of life. So I think there's things that, we have to think about outside of just, the immediate moment as well. So that's my last point.
That's great. I think Dr. Morgan provided a good statement. He said we have a duty to each other. And that's one of the things that actually he and I, we had some good conversations offline about this. One of the things that really motivated me to be more proactive about COVID, specifically my wife is a physician, doctor. So she actually just going to receive her first vaccine. And, obviously she's been, coaching me up. But after Dr. Morgan and I spoke, it wasn't just about me being healthy and some of the things that, I'm in good shape, I'm all this XYZ. It's if I caught COVID and I'm around my grandmother, or I'm around someone who has two morbidities, that person is more exposed and might not fare the same way I would. So that leads me into my next question is, we see that people that have multiple morbidities have a higher likelihood of contracting COVID, and then also dying from COVID. So why do we see an overrepresentation of chronic diseases in our communities?
I'm happy to start. I think, at the
Open.
beginning of, yeah, at the beginning of this pandemic, I did a webinar with some really big giants in health disparities research, and I asked them if they were surprised to see some of the disparities that are going on with COVID-19 in particular. And the answer was sadly no, because I think if you pull any disease kind of across the board, we see some similar disparities, especially among Black and Hispanic populations. And the thing that I think about as a researcher and what I call a social epidemiologist, which is somebody who studies the social conditions of that people live their lives in and how that affects their health, is that when we think about the Black population, the Black communities, and the history of the United States, our communities have been put in situations that uh, increase our exposure to bad social conditions. And those social conditions ultimately can increase our risk of these chronic diseases. And so, an example that you'll hear a lot is the history of redlining in this country, which, for those people who might not be familiar, this was basically the practice of making sure that Black people only lived in certain areas of town and that they remained segregated. And there was control of the government of the ability to move around and buy and purchase housing. And so, what does that end up ultimately meaning is that the populations or Black communities live in neighborhoods that are not as good as white communities. And what that looks like is not having green space to run around and exercise. It looks like liquor stores being disproportionately placed in our neighborhoods. It looks like tobacco industries targeting Black neighborhoods. It looks like having higher exposure to pollutants. And it looks like fast food restaurants being placed strategically in our communities. And so when you think about all of those things kind of stacked up against us, and you know that all of those things that I mentioned are directly related to some of the chronic diseases that we see, like high blood pressure, obesity or overweight, asthma, all these things, right, that end up being important risk factors for something like COVID-19, then what we call that in research is that we call it structural racism, or that there are structures that were set up that are embedded in the history of this country that made it difficult for us to come out on top. And that's what's reflected. That's what we see, and we see it across the board for a lot of things.
Let me kick it over to Shanelle. So Shanelle, would love to get your perspective, right? You see clients just as much as the physicians see their patients, right? Maybe not as much, but we're at Live Chair Health. We're working to change that. Why do you think chronic diseases are so prevalent in our communities? As Dr. O touched on a few things. Like the Chinese spotting that's every community, the liquor store, right? What are some things that we can do to reverse some of these trends that we see?
I think Dr. O, she really gave a whole full full circle, which was really impactful what she said in that short period of time. But I'll take it into another area. Let me take it around the corner, and let me take you to the culture of Black people. So there's a lot of sports and religion spoke about in the barbershop. Okay, there are heated debates. But when you look at our health, we kind of pick and choose when we look at, religion. And I hear people all the time in the barbershop say, well, I'm gonna eat pork. My grandmama ate pork. My mother ate pork. I'm gonna eat pork. I eat what I want to eat. God, when God's ready for me, that's when He's gonna take me. So we do a lot of foolish, activity that hurts us based on this construct of religion that is so embedded within our community. Oh, I'm gonna drink this liquor and eat this pork, but I'm gonna pray over it though. These type of activities and these type of behaviors leads us to where we are. We look at our culture and we think it's macho to have a big plate of food. The biggest plate of food that you have is more of a man that you are. And this is what I seen growing up. So we have to begin to change the culture. We have to begin to put some truth into the culture and start, not adding but subtracting. So when we begin to do that, we can begin to start healing ourselves. And I believe that's what Live Chair is doing. That's why it's so important coming into the barbershop, dispelling the myths, changing the conversation. When Live Chair came into Nile Style and you brought the classes, the conversations began to change. We began to start talking about food and ingredients in food. What are proteins? What are carbohydrates? Things of that nature. We are very susceptible people, and all we need is a push. But going back to what I originally said, kind of piggybacking off of what Dr. O said, we have to change that culture, our way of thinking. And until we do that, something's going to change. It's going to get worse.
I want to. Oh, go ahead, Doctor. Go ahead. Put another pin in it.
No, I was just going to say one other thing. I love that you brought that up. One of the things that I hear a lot, this idea that, let's say your family, the Johnson family, this idea that you're right. My grandma had diabetes. My great grandma had diabetes. My great great grandmother had diabetes. And sometimes I hear this idea that sickness is a family legacy. And as much as we hold on to that, I think that we have to, be bold enough to also say and reclaim for ourselves that wellness and healing can be a part of our legacy, and that whatever legacy that you thought you were a part of, it can stop and change with you. I think that that's part of it. But I agree that I believe in God, and I believe that He can help us help ourselves. I don't know if anyone's ever heard of, there's a story about a flood and a person who's praying for God to send him help. And God sends him, somebody comes in a ferry boat and he's like, no, God will save me. Go away, ferry boat. And the next thing you know, somebody else is coming up. They got a big sailboat, and he's like, no, God will save me. Don't worry about me. Then a helicopter comes and the person says, no, I don't need the helicopter. God will save me. And the person drowns and gets to heaven and said, what happened? And God said, look, I sent you a ferry boat, a sailboat, and a helicopter. So, let's include God and religion in our discussions if that's, if that's something that you believe in. But let's think about how God can help us get to the place of healing and wellness that we need for our communities, because I think God wants us to live abundantly. And so I was just gonna cap that off.
Yeah, and just to, this is obviously dispelling myths around COVID and misinformation. But since we took the church, I'll just put a point right, like even in the Bible, right, like the Apostle Paul says in 1 Timothy 4:8 that physical training is of some value, right? So like it mentions physical training and how taking care of the body is of value. So regardless of what you believe, whatever religion you believe, there is value in taking care of your temple. In addition to your point, Dr. O, I think it's amazing where people they'll pray for their health to be better. But, one of the ways that, the creator might respond and say, put down the Twinkies, right? Like, it's like, stop asking me for a miracle, and, you eating 4 cupcakes a day, right? So like, but anyway, not, but, that was a good sermon.
Or they might send you, Shanile in a barbershop. That might be your boat. That might get you there, you never know. Yeah.
There we go. So that you mentioned, so Shanile mentioned something great, and I want Dr. Morgan to chime in here. So changing the culture, I actually phrased it, change the culture, change the community. And so, Dr. Morgan, from a physician's perspective, how can the relationship from patient to provider be enhanced so that we can change the culture, which will lead to us changing the community, and more importantly, start to reduce these chronic diseases that are affecting people of color as it pertains to COVID?
I think that just I want to hang back to the previous conversation a little bit. Dr. O pointed out some very important things about how the things are stacked against the community. But then I think Shanal came in and really put the other side to it, which is to say, yeah, things are stacked against you, but you make the choices. And so I think what people have to begin to understand, and where the education becomes important, is helping people to understand more about what the healthy choices are, and that's what we're trying to promote with LifeCheer. You raise an interesting point, Andrew, which is there's another aspect to this where people actually go to the doctor, but then maybe they're not really getting the best out of the interaction. And I've been thinking about this a lot recently, and I've been thinking about the conversations I've had with some of my patients over the years. And what I would say to people is, when you go to the doctor, ask more questions. Just ask a question and let it hang there, and let the doctor address it, let him address it. Really, come in with questions about whatever it is that is bothering you. Put the question out there, and let the doctor be engaged with you. I think a lot of times people sort of coming to the doctor's office, and they expect to be talked to or talked at, and so they sit there and they listen to whatever you have to say, and they nod obeyingly, as you know, Dr. O, and they leave, but maybe they haven't gotten really the best interaction out of it. So there's a lot that we can do on the physician side, and that we need to do, and we all know that we have a lot to learn about how we communicate with different groups of people, and to do it better. But on the patient, and going back to what Chanel said, you can do for yourself as well. So I'd like to encourage people, when they go to the doctor, to ask more questions. I can't tell you how many times, Andrew, I've had a patient come to me, and they're asking me about something that's not in my area. And I said, well, did you ask the other doctor about that? And he said, well, they didn't think to do that. So I would just encourage people in their interactions with physicians to try to ask more questions to get more information.
Yeah, I would echo that. I think that is a wonderful point. I remember, I'm just going to bring up a little story. When I was in college, I was one of the only Black people in my class, and I used to be so afraid to ask a question. I didn't know how my teachers were going to look at me, and I was really fortunate that I had one Black professor who pulled me to the side, and she was like, why don't you ask questions? And I said, oh, I think my questions are dumb. I don't know how the professors are going to look at me or think about me if I ask them. And, she told me all these other people in these classes, all the other maybe non-Black people around you that you think their questions are so brilliant, their questions, I'm telling you, their questions are nothing brilliant. The difference is they believe they have a right to be there, and so do you. And she challenged me to believe, in terms of my education, and I would reflect this about your health, that when you're in your doctor's office, that they actually work for you, and that you have a right to ask whatever question that you want and to get everything out of the encounter. And so I just wanted to echo that fact. And sometimes it can be really intimidating. And so I'll say the flip side of that is you also, as much as I know that everybody doesn't have the ability to do this, but if you do, and you're in a situation where you don't feel comfortable, that you can't really step into that role where you feel empowered and that it's your right to ask questions, then you should find somebody that you have a relationship or can build a relationship with, in which you do have that, where you feel like you can be open and honest. Because as Dr. Morgan knows, the more information that I think that we have as doctors, the better we're able to help people get to their ultimate goal, right? Which is, again, that health and that wellness and that abundance. So I was just putting that up.
No, that's great. One of the things, shameless plug, I think one of our team members dropped it in the chat. I was actually going there, but Dr. Morgan raises a good point, and you cemented that, Dr. O, is that asking questions, right? And so one of the beautiful things about Live Chair Health is we have our brain trust, right, which is a council and a cadre of physicians across the nation that give Live Chair Health expertise on how can we improve the relationship between patient and provider. And one of our members recommended putting in our Live Chair Health app a section that's titled "Making the Most Out of Your Doctor's Visit," right? Questions you should ask. So one of the things that we've done when we're doing screenings in the shop and when people are being introduced to Live Chair Health and we connect them with a primary care physician, for example, we say, hey, download the app. Here's a list of questions that you should ask. And then based on that information, use the content in the app to be able to, get you on your path to better health and wellness. So it just goes to show when, providers bring their expertise, business folks bring their expertise, then we have hair professionals bringing their expertise. We can really start to, as to quote the great Shanile, change the culture so that we can change the community. Dr. O, you going to say something?
Yeah, I was just going to kind of piggyback off of that point and just say one last thing. As an educator, as a physician, I'll say that if you don't understand something that your doctor or your provider is telling you, it's actually on them. That's how I feel. It's on me, the doctor, to figure out a better way to explain it. It's not on you for not asking the right questions. So I just want to continue to put that out there to encourage people to ask questions. And if you're not reaching a level of understanding, it has nothing to do with you. It just means that maybe we need to figure out a better way to explain things and break things down. So that's what I'm always challenged with when a patient says, I still don't understand. I said, you know what? I need to learn to do a better job of explaining that, don't I?
Right, right. So, even I think we dropped some words here like morbidity. People might not know what these mean. But anyway, we have 9 minutes left in the call. So I want to turn it over to the audience. We have a few questions that have trickled in. So the first question is, what are your thoughts regarding the upcoming vaccines by Johnson & Johnson or Novavax?
Mm-hmm.
Yeah. Both of the physicians will have to respond to this. I'm kind of interested to hear your thoughts too as well.
I was thinking about this today. The Johnson & Johnson vaccine is on the verge of getting its emergency use authorization. And the more vaccines we have, I think the merrier if they all work. The Johnson & Johnson vaccines works. A lot is being made about this issue of, well, it's 66% effective and the others are 94%, so they must be better. I just want to make a point, which is at the outset, before we had any vaccine, the target was to get something that was around 50% effective. So if we had never had the Pfizer vaccine or the Moderna, the Johnson & Johnson, people would have been overjoyed to have it. The second thing is it has some real advantages. One of them is that it's a one-dose vaccine. We're now hearing about, well, we get the first dose to somebody. How are we going to find them for the second dose? Are they going to come back? Will we have another dose if they come back? That kind of thing. That's a big simplifier that gives it an advantage. And the third thing is, the storage issues that we have with the Pfizer vaccine and the Moderna vaccine, where they have to be kept in these super cold freezers. And once you thaw them out, you only have 6 hours. And you're hearing about people basically grabbing people off the street to vaccinate them because this dose is going to expire in 1 hour. The Johnson & Johnson vaccine, you can store it in a refrigerator. And so you're going to be able to get it out there into more sort of corners of the society that are hard to reach because of these other distribution issues. So I'm happy to see it come online as a third option for us. The other thing is that we've all been thinking and talking about what's happening in America, but we live on a very connected globe, right? No sooner had we heard of a South Africa variant than boom, it was here. And we heard there's another variant in Brazil and boom, it's here in Maryland, right? So we also need to think about how we're going to get vaccines to these corners of the world where the virus might hide out, where people are harder to reach. And so I think the Johnson & Johnson vaccine is going to be a very important weapon because of its ease of use, versatility, those advantages that it has over the other two.
Yeah, and I'll just add to that. The other thing is when everybody's listening to information that you hear about vaccines, the questions that are important to ask too is how these studies were set up. And one of the interesting things about the Johnson & Johnson is when you actually look at severe disease, which is means that you get really sick with COVID, it actually had 85% effectiveness, which we call efficacy, but effectiveness. So that's actually great. That's incredible. So it's the lower numbers that you hear are maybe for mild disease, but that wasn't actually how it was designed and set up. They were looking for severe disease as their primary outcome, and it did really well with that. And I echo Dr. Morgan to say these numbers are really extraordinary. And the other point that I'll make around these kind of variants, just to make it brief, one of the ways that we stop variants from happening is by vaccinating more people. So if you vaccinate people, less people are able to really spread this around, and that's how variants are produced. So I'm on board with saying if we have something that's pretty effective, that we should continue to use it. And it's great because we can get it out to these communities, these rural communities that might not have had access because of these storage issues that Dr. Morgan brought up. So I think overall it's a positive thing. And I think there's even some data now that's saying all of this stuff is rapidly changing, but even with the first dose of the Pfizer vaccine, they're seeing around 80 to 85% efficacy is the word we use, but it just means effectiveness for that dose. And so people should still get their booster and second dose, but it's really promising just to have this kind of data. And when you look at those numbers compared to the Johnson & Johnson, I think it all paints a good picture. So I say getting the vaccine that is available to you as soon as possible is probably the best approach that we have to get us back to a normal life where we can be in community again.
Absolutely. That's great. So we have a couple minutes left, and we're going to take one more question, and then we'll go around the horn just for closing thoughts from each panelist. And I just want to thank everyone for all the attendees for spending about an hour of time with us. Shameless plug, livechair.co. Definitely check out the website and see what we're up to. We're coming to a city near you if we're not already there. So this last question is it's anonymous. So is there a particular vaccine that is better for me if I have a particular health condition?
I don't know that we have any data to answer that question right now. I think that the advice I'm giving people is that you should get whichever vaccine, as Dr. O says, becomes available to you first. But I don't know that there's going to be particular vaccines that are better for people with particular conditions.
Yeah, I agree with that. I think that one thing to remember is that we're rapidly gaining knowledge on this, but right now we don't have that data. I will put a small kind of plug in as a women's health physician, as a physician who thinks about women trying to get pregnant, that some of the knowledge that we have right now is that it's safe for women who are trying to conceive, and that the kind of big societies that give us recommendations on pregnancy and women who are breastfeeding are also saying that they feel like the two mRNA vaccines that we have available right now, which is the Pfizer and Moderna, that they're saying that if you're pregnant and lactating, that there's no reason that you shouldn't get a vaccine. So I know that wasn't really the question, but it's just something that I wanted to put out there. And I think that you continue to have these conversations with your healthcare providers, but right now there's really no contraindications which means that you shouldn't get it that we know of from a healthcare provider standpoint. And every day we're collecting more data. So when I said we had almost 20 million cases worth of data, we're going to keep collecting that data. And the more we do, the more we'll know as well.
So to those people who keep saying that they're waiting, Dr. O, for more people to get the vaccine, I think it's 20 million people. I don't know what you're waiting for. What's your number? We're at 20 million. And what we need to do is get to 300 million as quickly as we can.
Mm-hmm.
Great. Well, with that said, a minute left in the call or on this webinar. So let's take it around the horn and get closing thoughts on your call to our community is X, right? So you fill in the blank, and then any other plugs that the panelists want to present, go for it. So let's start with Shanile. Let's go to Dr. Morgan, and let's end with our queen.
Where we started, right?
So, and then I'll close this out. All right, Shanile.
Sure. My call to the community is to use the barbershop, my barbershop, as a platform for healing for our community. When you look at history in barbering, we were known as barber surgeons. When you look at the barber chair, you look at the optometrist chair, you look at the dentist chair. It came from barbering, if you actually look at the history. So I want to sort of bring back the authenticity of what the profession is all about, because it's about healing. And if we can do that, one shop, one client, one customer at a time, and make our community feel like, hey, you know what? We belong. We deserve a relationship with a PCP. We feel comfortable inside of a clinic, inside of a doctor's office, because now we're equipped with some knowledge, some education. Because the fear comes in when you don't know anything about it and you're kind of like left alone. So that's why these forums, and thank you for having me on here. I'm really passionate about everything that I do in the barbershop, in the community. I think that the barbershop is a hub. I think it's one of the lasting things that we have as a community. And just a little side note, Martin Luther King and Dr. Martin Luther King and Malcolm X, when they met, oftentimes they met in the basement of a barbershop, because that's where they can get privacy. That's where they felt safe. And we want to continue that legacy on. So that's my duty here.
Pin drop. I have a mic. That's great, man. Dr. Athol.
My call to the community is simply this: get vaccinated. Get vaccinated as soon as it is available to you. I have gotten vaccinated. I got it as soon as I could. I'm telling my family and my friends to get vaccinated as soon as you can, and that's my call to the community. What we have to do is lock arms together and march this virus out of here. We cannot think individually. We have to think collectively. We have to think of this as we, not I. And what we need to do is get as many people vaccinated as quickly as possible so we can defeat this coronavirus. That's my call.
Absolutely. I mean, you said it brilliantly. A duty to each other, and so those words definitely resonate. Dr. O.
Yeah, so I'll say a couple of closing things. So for the people who have gotten vaccinated, even despite some of their concerns, Thank you for your service and for helping us move our communities, I think, to a safer place where we're not going to be left behind. And to the people who are still unsure, I would just really encourage you to continue to ask questions. I think knowledge is power, and it can liberate us if we let it, but we have to ask the questions. And kind of to the point of this whole panel and why we do these discussions, if you're still unsure, try to find the spaces where you can ask questions to people that you trust and believe. You know, Dr. Morgan and I are Black physicians who've gotten vaccinated. I've documented my vaccination experience on my social media, as have a lot of other Black doctors. And the more people in our community who get vaccinated and can share their experience and even their concerns, to let people know that you might have symptoms, but you survive and you're gonna be okay. I think all of those things are important. So, you know, get vaccinated, yes, and if you're not there yet, continue to ask questions so that we can get our communities to move forward.
That's right.
Absolutely. Well, I would do a disservice if I added on any other verbiage to what these fine panelists have said. So I just want to thank everyone again for taking the time out to join us on our second webinar. Again, go to livechair.co for a plethora of information from how to get COVID. We actually have a sign up available if you're in Maryland, and we're working on rolling that out in other states if you're interested in getting the vaccine. In addition, and more importantly, you know, my charge is, yes, get the vaccine, but more so, let's work on reversing the trends in chronic diseases, right? Because COVID eventually will go away. But I say this again and again, it's not like diabetes and hypertension and lung cancer and CKD. I've just said, okay, we'll just take a time out. Like, no, these things are still ravaging our community as well, and even more so because people are foregoing treatments, but that's another webinar. So let's take care of each other. As Dr. Morgan said, we have a duty to each other, and have a great night. And thanks for joining us.
Thank you.
You.
Bye, everyone.